welcome to the Headache Doctor Podcast, where it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication, allowing you to thrive in everything you do. Hello and welcome to the Headache Doctor Podcast, where it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. Today, we're going to talk about the difference between the chiropractic method of treating someone with headaches and migraines and the physical therapy method, okay? So this is a question that I get all the time, and I feel like there's a confusion. I was talking to another provider over the weekend, and he was not sure the difference between our approach to care and a chiropractor that specializes in upper cervical. So if you're someone that has seen a chiropractor that focuses on the upper cervical spine and treats the atlas and the position of the atlas, we're going to dive into that, and then we'll talk about chiropractic in general. A disclaimer about this episode is I am not a chiropractor. I have not gone through the schooling that they have gone through, meaning I am going to speak to the philosophies that chiropractors use to guide their practice, I will speak in general terms. There are all types of different chiropractors out there, and there are chiropractors that I like and I think are really valuable to our healthcare system. There are some that I think are not so helpful, and the same is true for physical therapy, okay? So for my own profession, it's not as if all PTs are created equal, just as all chiropractors are not created equal. But what I can speak to, and I feel comfortable speaking to, is the philosophy behind chiropractic. And so the intent of this podcast is to help you discern. So if you've been working with a chiropractor and you found some relief, but you're looking for more, you're looking to have a big impact, and you're wondering if there's a different approach. Is this chiropractic thing similar to what we're doing here? And so what I want to answer is the question of what would the difference be, and how would you go about finding that or understanding that so that you can find the help you're looking for if you want to approach this more from a movement perspective. All right, so we're going to talk a lot about alignment versus movement. Alignment versus movement. So the chiropractic world would be in the alignment category, and the physical therapy world would be in more of the movement category, okay? So let me start off with just sharing a little bit about my story. So I'm a physical therapist. If you've listened to this podcast and you've thought that I was a neurologist, or you found us online and you thought that I was a neurologist, I want you to rest assured that it is a good thing that I'm not a neurologist, because neurologists are trained to in the medical field. So the MDs all have their training that's very chemically based. It goes down to the cellular level, and they're looking at how these pharmaceuticals interact with the cells and the different responses that we get, and trying to get our body back to what we know as homeostasis, or what normal would be, okay? Now, to have a podcast that provides you with interesting enough material for someone that's suffering with headaches and migraines that's not pharmaceutical, it really suits me well to be a physical therapist, and that's all I'm saying. So to be a neurologist and to have the pharmaceuticals that they can prescribe, those aren't necessarily bad, because symptom management is something that we like to have as far as helping someone with headaches and migraines, because one, not everyone has access to this type of care, and two, even if you do have access to this type of care, migraines can be really, really debilitating and really stubborn, and so having the migraine medication on hand is not always a bad thing, okay? But being a physical therapist suits me well for educating you on movement, because movement's important when it comes to understanding the underlying problem behind many of these headaches and migraines, all right? So when I was going through physical therapy school, I didn't necessarily have an interest in headaches or migraines, but I got connected with this gentleman that works out of a clinic in Minnesota. So he owns a clinic. His name's called Dave Weber, and he came to the Mayo Clinic and he taught a weekend course on the jaw and the neck, and it was fascinating to me. So I went and shadowed him. He was working on the upper neck and treating people with headaches. People would come from all over Minnesota, and they would find relief through his techniques that he was able to provide or apply. Now, what he was doing, I bring the story up because this was kind of the first connection between movement and all of the education and background I had as a student at the Mayo Clinic and in the physical therapy program. So the foundations of physical therapy are built on function, movement. How should the body move? All right? So whether it's the neurological system and how our brain communicates with the musculoskeletal system, so the muscles contracting, relaxing, coordinating muscles, coordinating that movement, we need to understand our neurological system, our brain, our peripheral nerves, our brain stem, and how that all communicates, especially if we're dealing with someone that has a stroke or a traumatic brain injury. Rehabbing those patients is it's important to understand the neurological side of things. So we had a pretty robust neuro education. In addition to that, we obviously know the anatomy and understand how the musculoskeletal system, so muscles, tendons, ligaments, bones, joints, how it all interacts, how it allows us to stand up straight and walk and move and be dynamic and lift things and write with a pencil, fine motor movements, all of this. And so understanding all of these different systems that allow us to move, that's kind of the foundation of physical therapy. And it's a very helpful skill because when people are in pain, oftentimes that pain can be sourced back to a movement problem, a loss of movement, a change in how we function, compensations that go on for years and years that we need to correct. We need to peel back the layers of what are these improper movement patterns that you've been doing, and how can we restore normal function or what should be normal function or get close to that function so that your body isn't carrying this level of stress and tension that's leading to pain. So that's the background of physical therapy in general. It's not unique to me. Any physical therapist, that's how they were trained. That's how they were trained to think. That's how they should be practicing. We want people to move, all right? So when it comes to that trend, so taking physical therapy and then comparing it to chiropractic, I simplify it by saying that physical therapists want people to move, and not to say chiropractors don't want people to move, but the foundation of chiropractic, again, I haven't gone through their education, but my understanding is that it's based on alignment, okay? So there's this subluxation model that they're working off of, most are working off of, and it all goes back to alignment of the spine, okay? And then from there flows all sorts of different things that chiropractors would claim if you correct the alignment of the spine, you can correct these other things. So, but for the sake of conversation, we're talking about headaches and migraines here. So when we're looking at alignment, what is alignment, like where should alignment fit in to the philosophy of a physical therapist? Does it complement it? Is it just completely different? Can a chiropractor and a physical therapist work together? My answer to that is maybe. It gets a little bit complicated, okay? So if someone comes to us and they say, and they start our process, every time, if they were to ask the question, should I also be seeing a chiropractor? My answer is our process is set up so that it's we don't necessarily need anyone else working on your musculoskeletal system. So I don't need someone that necessarily is going to look at your alignment or look at your body, your physical body, and how it moves. I don't need someone bringing in a different perspective, at least not right away. So sure, if we get stuck, if we get down the road and we're not finding the relief that we want, that may be an option. I've got a few chiropractors in town that I like, and we can work well together. But for the most part, the philosophy that they're working off of and looking at alignment and then basing treatment off of alignment is different enough that, but addressing, I guess I would say, a similar problem in a similar area, but with a different evaluation and treatment process. That oftentimes if someone's going through our treatment approach and our process, I don't necessarily find it helpful right away. Now, so what's the difference? So when we think of alignment, you think of posture, you think of these normal curvatures through your spine, okay? And so if I'm gonna sort of paint the picture, if you haven't been to a chiropractor in general, so they'll use an x-ray image, a still image to look at the alignment of the spine. and then they'll come up with data that says, okay, we need to treat here, here, here. These areas are, whether they use the word like subluxed or they're out of place or something like that. And then they'll do the adjustments, which the adjustments are usually the quick, you get the cavitation or the pop, and then you leave, and oftentimes you will feel better. And the assumption is that with the x-ray they took, or with the assessment of the alignment and then the treatment, that you are back in alignment. Okay? So that's one of the problems, is the flow of that physical therapists generally have, is that when a physical therapist is understanding the body, and if there's dysfunction in the body, and we want the body to move better, there's so many different types of tissues, and we need to understand how dynamic those tissues are, that just looking at a still image of someone would be really hard to tell how they actually move. Now, it does provide us with some information. So if someone has a significant forward shoulder posture and a forward head position, or say their neck is straighter than it should be, they've lost curvature there, we can, I think it's fair to reason that maybe this person is more sedentary, they're sitting more, their head is generally forward throughout the day, and we see those compensations in their spine, okay? And so as a physical therapist, we want to consider all these different types of tissues that are involved in playing into that posturing, and also the different movements or lack of movement that goes into someone getting into that position. All right, so when it comes to the evaluation process, physical therapists are going to want to see you move. We're going to want to see your head rotate left and right, look up and down, side to side. I want to know I want to know what the movement feels like in the upper cervical spine, so that OA nodding, C1 and C2 rotation, what the mid-cervical spine feels like as far as movement. Is it able to glide back and forth, or is it restricted? Is it protective? Are there muscles guarding that area? All the way through the shoulders. Are your shoulders able to move forward and back? Are you able to reach up overhead without compensation? Do your lats and your subscap, these muscles that are going to pull your shoulders down and in, are they able to allow you to move your shoulders in this more dynamic range of motion? So people can have a static position that they're still functional in, that they can still move in and out of. And so that movement in and out of that static position is really what's going to be important as far as the physical therapy perspective. Now, going back to the chiropractic perspective of alignment, one of the things that's sort of assumed or educated in that process is that once we correct the alignment, the movement will follow. And that's something, as a physical therapist, I have a hard time with. So correcting the alignment, and we'll get into like the treatment approach and how those are different, but let's just assume the alignment is corrected. Now, within the let's say 5-10 minute session, however long it takes the chiropractor to correct the alignment. So the head sitting on the first bone, the head on the atlas, so especially with upper cervical, they're working a lot with the atlas. Now, I love that, because that's kind of the epicenter of a lot of these problems. So the head sitting on the atlas, if the atlas is shifted one direction, the head will rest in sort of a tipped orientation. So your head might have a 5-degree tilt to the right. And so your head might want to correct, because your brain wants your visual input to be in a horizontal plane. So your head might be more neutral throughout the day. And so what happens is your spine has these compensations that are going to kind of translate down through the mid-neck, into the shoulders, that sort of thing. And so correcting that little shift in the atlas, putting pressure through the atlas to correct that is a really good thing. Now, it's one piece of the puzzle. And so as far as upper cervical goes, I think they get closer to correcting the actual problem, or addressing the actual problem. If we go into general chiropractic, if they diagnose a few misalignments in the spine, and then they do their adjustments, again, they're getting these cavitations or these pops. It doesn't take very long. And then you might feel a little sense of like relief, or your neck moves a little bit easier. So there is some short-term benefit there, but the problem, as I see it, would be that we're looking at one element of movement. Okay, so the the alignments, when we look at the skeletal structure, so oftentimes there is a skeleton model, a model of the spine, or at least you're looking at your x-ray. And so we're looking at bones. Now, bones as they sit on each other are oriented in a way that caters to certain movements. And so it's fair to reason that if you correct the alignments and allow those joints to all line up correctly, movement should follow in a more appropriate manner. So movement should be easier. That actually makes a lot of sense to me. The thing that I think is missing is understanding all these other tissues that are involved. So when we think of tendons and ligaments, the muscles themselves, so these soft tissues that are actually stabilizing our skeletal structure and then allowing us to be dynamic. So that's what we're assessing when we want to see you move. So as a physical therapist, we do care about alignment. We want to see how those bones are stacking up and lining up, because when you are dynamic, that can change and it can lead to compensation. So we do care about posture. I can correct someone's posture, just tell them to sit up straight, and their range of motion could improve in their cervical spine, or it could be less irritating or less painful, and all that has to do is just how they were aligned, okay? But if I took a still image, I wouldn't necessarily know if how someone's going to respond, or if they're even able to move or not. And so there's a lot of assumptions that have to be made because we don't have the information from the muscles, the tendons, the ligaments, these soft tissues that help us move, okay? Now, the thing to understand about muscles, tendons, ligaments is that they're constantly responding to stress, okay? So they're also oftentimes where the actual pain signal is coming from. So irritation in these tissues might be what is likely sending the actual pain signal. Now, if your head is forward, okay, there's muscles that run from your shoulder to your neck and then along your neck on each side of the spine that are going to have to work really hard to hold your head up. Your head weighs about 10 to 12 pounds, okay? So if throughout the day your head is forward, the amount of stress through these muscles will increase. Now, the problem in that situation is it could be that you're not able to sit upright, okay? And if you're not able to sit upright, it's something that we have to understand as far as how dynamic are the joints in the neck. So if you have a forward head position, you've probably, if this has gone on for long enough, you've probably trained the muscles, ligaments, and tendons to adjust and sort of rest and accommodate to that forward head posture. So what that means is, let's assume a joint should have 45 degrees. Let's say C1 and C2. You should have 45 degrees of rotation. Well, in order to have 45 degrees of rotation, the alignment of the bones sitting on each other is important, because if it's shifted one way or the other, that can limit or impact the amount of rotation. But it's also, and I would say even more importantly, the ligaments that are connecting those two joints, the laxity or the amount of give in those ligaments that are connecting a bone to a bone. Okay, ligaments connect bone to bone. If there's not enough laxity within those ligaments, you're not going to have the range of motion you need. In addition to that, muscles and tendons. So a muscle connects to a tendon, which connects to a bone. If that muscle and that tendon have adapted, maybe they've adaptively shortened because they're not going through their full range of motion, then you're going to see irritation through the muscle, and we're not necessarily going to see that with a static image. We need to understand if the muscle can stretch and then contract appropriately, okay? And we don't get that information on a still image. Now, the ligament connecting bone to bone and the muscle tendon that's going to contract and relax and allow the joint to actually move, those are two things that are going to impact the available range of motion in a joint. Now, in our treatment process, what we're doing are called joint mobilization. So it's an amount of pressure that takes the joint, it picks up the slack in the joint, so the ligaments that are surrounding the joint and also the muscles and the tendons, it's taking up slack in all of that tissue, and then it's pushing it a little bit further, okay? So it's teaching those tissues to move a little bit further, and we have to do that over and over again. Now, the reason that we need time, so our sessions, The shorter sessions are a half an hour, the longer ones are an hour, and that's me as a provider working on you that entire time. The reason we need time to do that is because the tissues are going to respond positively to that stress over time, okay? But it's not something that happens quickly. Now, if you think of how you got into this situation, now maybe you've been, let's just take the desk situation. So you work at a desk, you're looking at a computer, your head's forward, your shoulders are forward. Now, maybe if you've just started that type of job and you were pretty active, you were pretty dynamic, maybe you're just coming out of college and you're working in a desk job. So right off the bat, you're probably still able to move in and out of those positions. Now, if you train your body to keep those movements and you're really dynamic, maybe you have an active exercise program, you get up and move, you do the things that we've talked about, you're going to restore the actual function, the actual ability to move in and out of that full range of motion. So if we think again of C1 and C2, that 45 degrees, if you're doing things to actively keep those, you can have a desk job and still maintain the range of motion. But most people, let's say, are sitting at their desk, their head's forward, and they're not giving the joint the dynamic full range of motion that it's wanting throughout the day. So what happens is these tissues respond, they adapt, okay? So they'll adaptively shorten. And the range of motion that was available at that joint may have been 45, but now it's gonna be 20, or maybe it's 0. Maybe your body's been compensating for so long that it hasn't really even needed to use this C1 and C2 joint at all. And so what happens is those ligaments tighten because you haven't told them that they've needed to move in so long. So here's where it comes down to sort of the basic components of why physical therapy may be more effective than the alignment approach. So if you think of going into, if you think of a treatment session that involves just a quick sort of cavitation popping that is intended to improve alignment. So what's happening there is you're getting the cavitation, you're getting the pop, and that's essentially you're creating space within a joint that creates this gas and it makes a sound, it makes this popping sound. There's certain endorphins that are released, chemicals that they allow us to feel better, okay? Endorphins that the joint itself, it's kind of therapeutic on a local level. There's also, in the short term, there can be improved range of motion, just because if there was some irritation in that joint and now it feels better from the cavitation, you can have improved range of motion. Now, what we're not changing in that quick 2-3 second technique of getting the pop is the actual lengthening of the ligament. We're not necessarily changing the muscle or tendon complex itself. We can see relaxation in the muscles after we get a cavitation like that. But the ligament, so the structure that's actually holding the bones together that's adaptively shortened, we're not necessarily changing the ligament because we didn't necessarily put force through the ligament itself, okay? And if we put enough force through the ligament and in that short moment, the ligament's not going to respond in a positive way. Now, those techniques are generally safe, so it's not like we're going to see any strain or type of force that would cause damage to the ligament. But it's not enough force it's not the right amount of force for the right amount of time to actually allow it to be therapeutic and see the lengthening effect in those ligaments themselves. So what we see here in the clinic is a lot of our patients have seen chiropractors for a long time and found some benefit there. But when they come in to see us, their neck is still really tight. And even patients that go see the chiropractor the day before or even the day of, and they'll say, yeah, the chiropractor said my alignment looks really good, and they'll come in and their neck will be really tight. Now the chiropractor maybe didn't treat them or they did treat them, and maybe there was some benefit, but the patient will still come in and will still be able to reproduce their headache and work through the tension that was really the underlying problem, okay? So it's hitting at an element of the problem, but there's these other components that have to do with how we move and the dynamic nature of our body, and then it's restoring that function, restoring movement. That's really key. So as far as like from a lens of an outsider, if you took a picture of what we do and took a picture of what a chiropractor does, it would look very similar. And so this is it's a hard concept to understand and explain, because when someone comes through our doors and we start treating them, they lay down on a table and I'm using my hands to work on their neck, which is very similar to what the chiropractor does. But it's that foundational alignment versus movement, and then our techniques flowing from that foundational difference. That's really the important difference. And then the key factors in regards to our treatment and what it actually looks like is we are focusing on restoring function and movement in specific segments of the neck, which takes time. Our sessions have to be longer and we have to see you. Generally, we want to see results pretty quickly. Our process takes 6 to 8 weeks, which may even be shorter than a lot of chiropractors in their plan of care. But we want to see results. So the proof is in the pudding, okay? So when someone's going through a process, kind of our main outcome measure is, do you feel better? Is this helping you? Do you have reduced symptoms? Is the frequency reducing? Is the intensity reducing? Okay. I would say that there's a group in the chiropractic world that will just use sort of a test-retest as far as looking at spinal alignment based on like whatever sort of evaluation modalities they have. So if they're gathering information somehow, they will tell patients, oh, this looks better. And then the patient will leave and they'll feel like, okay, this is helping, but there isn't as much focus on their symptoms. So if your symptoms come back, it's kind of, well, what did you do? Well, let's get you back in alignment. And there's sort of this nature of, well, I always need to be in alignment. Well, in our process, so we talked about 45 degrees of C1 and C2 rotation. Now, when we go through our 6 to 8 week process, it's not as if I'm wanting everyone to get 45 degrees of rotation. It'd be great if we could, but it's part of aging, it's part of changing in our body that we probably just aren't able to get all 45 degrees back. But the good news is that we don't necessarily need to, because everyone's going to be able to function at a different level. So if you can function pain-free and manage these symptoms by allowing your body to get the movement it needs with a simple home exercise program, then that's success. And we have people find 80 to 90% improvement in their situation just by doing that. And so we start the conversation of looking at movement, talking about where there's a lack of movement, and then addressing these specific joints. But then from there, the conversation quickly goes to, how are your symptoms? How are they improving? And then your end result as far as motion and posture and how everything's lined up might look different from someone else's. So I don't need to keep you coming back and back and back until you look like you have perfect posture, because the assumption that perfect posture is what you need to accomplish, I would say is sort of a false assumption, because a lot of people can function really well and do things very differently. There was a runner in PT school that a woman that won the Boston Marathon. And as a physical therapist, if you would have seen her run, you would have said, stop immediately, because there's a lot of, in her gait and how she was running, it seemed like, oh my gosh, you're going to get injured really quickly. But she was a high-performing athlete who won the Boston Marathon, meaning she didn't have pain. Her body had adapted to those stresses, and she was using her body in a way that was fine. And she was functional. She was thriving, okay? So we don't want to put assumptions on people as far as like, you need to fit into this perfect model, otherwise you're going to be in pain. And so there is a little bit of that can go on. Now, to bring this full circle, to summarize, we want the body is dynamic, so movement needs to be a part of the treatment plan. Static posture gives us a picture of what the body might look like dynamically, but we need to understand that dynamic component. We need to see people move. And then I'm going to put a plug here for chiropractic, because if you're not able to find, so like if you're not in Colorado, if you're not in Colorado Springs, if you're not able to come see us, then I would actually say try chiropractic. Because if you've gone through our healthcare system and you've been stuck on meds, you need someone to do something to the upper part of your neck. You need someone to address your neck. And generally, physical therapists are not that confident with treating the neck. So I would say go find a chiropractor, and that might be a good place to start. Now, if you can find a good physical therapist that is comfortable treating the neck and can apply some of these techniques to to improve mobility to the upper part of the neck, I would say that's ideally what you want to look for. We find great results, really good results with this process. And so I want you to, if you feel stuck, that's what I want you to look for. A manual physical therapist that's comfortable treating the neck in the context of headaches and migraines. But my friends in the chiropractic world should not be discounted, okay? So the sake of this podcast was to educate you on why we believe our approach is better or provides better results. And I may be biased, but that doesn't mean I'm wrong. But chiropractic definitely has value here, okay? So don't misunderstand me. If you're trying to choose between the two, find a good manual physical therapist. If you are not able to find a good therapist, go see a chiropractor, especially an upper cervical chiropractor, because them doing those techniques to the atlas, shifting the atlas, that can really be helpful for patients. All right, so there you go. I could probably talk a lot longer on this subject, but I felt for the sake of clarity, and I'm sure some of you out there had this question, as the provider I talked to over the weekend had as well. The difference between alignment and movement, it's important to understand, because from that flows not only your evaluation, but then the treatment and the plan of care and everything from that. So from an outside perspective, just because we're working on the neck does not mean it's the same thing as a massage or a chiropractic treatment plan. And so that difference, as far as you finding relief, is worth talking about. If you have questions on this, if you disagree, reach out to us. But I hope that this is helpful for most of you listening and in your search for finding a provider that can help you. Thank you so much for listening to the Headache Doctor podcast. As always, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. Thanks for listening.